breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone, welcome back to this week's episode of Brainstorming with the Docs. I'm Dr. Kolby Condos, my co-host and co-conspirator, Dr. Glenn Harrison. What's up, buddy?
I'm doing good. I'm doing really good. This is a great one. I think it is. Talking about rheumatoid arthritis. It affects so many people, and I see it every week, at least every week.
Oh, yeah. Yep. Yeah, very, very common. Can be very, very debilitating. And we're going to drop some information for you guys so you are more informed about what it is and maybe what some strategies are and who it affects. So if this is your first time watching on YouTube or listening on the podcast platforms and you got value out of the content today, then make sure you hit notifications, turn on, hit like and subscribe, and we'll keep rolling out content to you each and every week, and you'll never know when we might cover something that's applicable to you in your life. So without further ado, let's start rolling through what rheumatoid arthritis is.
Rheumatoid arthritis. It's just another arthritis with a bit of a twist. I like to say it belongs to a family of other arthritises that are considered inflammatory. Mm-hmm. It's an immune problem, and it's I guess to simplify, it's a chronic inflammatory autoimmune disorder. So it's not a wear and tear arthritis like some people like to think it is.
No, yep, it absolutely is. It has to do with the immune system. The immune system likes to attack certain joints in your body and causes a lot of deformities in there and can cause some swelling and pain and all that kind of stuff. So yeah, it can be pretty debilitating. Mm-hmm. Seems to affect the proximal interphalangeal joints, which is like the joint right between the palm of your hand and the first joint in your finger. Mm-hmm. And it causes an ulnar deviation of that. And what that means is that it actually will like curve away from your thumb.
Towards your pinky.
Yep.
Yeah, towards your pinky.
Deviates towards the pinky.
So whoever's watching this, not listening to it, if you put your hand up and you think of your fingers, just all of your fingers tilting towards your pinky. It doesn't happen overnight, but a progression of it, this is a common thing, ulnar deviation. So deviating towards your pinky, all of your fingers.
Yep. Can cause pain and swelling in your joints. That could be, that can be a lot of other things too. But if you have a lot of these things, then maybe looking into investigating it further.
The type of arthritis, because there's a lot of people, they have aches and pains, and then they say, oh, then the doctor says they have arthritis, but it hasn't quite been determined what type of arthritis. And a lot of people that I see, they've been diagnosed with some form of arthritis, and they think it's just the sentence. It's all it is. It's just what it is. Nothing can be done. And that's so far from the truth. Every form of arthritis, and especially rheumatoid, all have at least some inflammatory condition to it, some immune response. We've talked about inflammation in the past a million times on these podcasts.
Well, we've talked about autoimmunity too. So if you do have an autoimmune disease or condition, make sure you go back and listen to that podcast, because that would be really valuable for you.
Yeah, it'll apply directly to rheumatoid arthritis. This rheumatoid arthritis is you were saying, Dr. Kolby, also like pain in hands and wrists are the most common with rheumatoid, but then you'll also get swelling of your joints in your hands. You'll see that a lot in redness. And I'll always ask people, I know you probably do the same thing, Dr. Kolby, I'll ask them when we're trying to determine what kind of arthritis, or at least have a theory. And if they say it's always worse in the morning, stiff in the morning, hard to open like a milk jug or a bottle in the morning, or even squeeze the door handle. There was a lady I worked with. She couldn't squeeze the door handle enough to let her dog out in the morning, because that's how much her hands and wrists ache.
Even something as simple as like holding a coffee cup, right?
Oh yeah, that's right. A little achier, and then throughout the day it gets a little bit better.
Right? Less stiff, less painful. Mm-hmm. You can actually develop like nodules in your joints. What do they call them? Panises?
Oh,
I can't remember. There's a specific name for them. I can't remember them now.
Oh, well.
Dang it.
Well, we'll leave it to the radiologist.
Yeah, right. And then it actually can affect your neck as well. So it can cause degeneration in the joints of your neck. So obviously want as much mobility, safe mobility in your neck as you can get. So catching this early and being proactive about it could be definitely beneficial and lead to a better quality and longer quality of life. For sure.
That's right. And when we're talking about hands, wrist, neck, the joints get so flared up and such an immune response going to the joints, it'll start affecting the muscles in those areas as well. So that's why people can still get some brief temporary relief with, massage therapy and some acupuncture, but it is brief and temporary. And it's not the long-term game, because it's not a muscle problem. Like all the autoimmunity we talked about, it's an immune problem where synovial fluid mostly is being attacked in that joint. And then it's becoming inflamed. And if rheumatoid arthritis, if there's enough of an immune response going on to those joints for a long enough time, it'll create bone changes.
Yep.
But a lot of people will have rheumatoid arthritis in their earlier stages, actually for years. They don't yet have bone changes that define on an image, an x-ray or a picture like that. And that is great, because that's you're catching it super early. But even
there's no lytic destruction of the bone and joint yet.
Exactly. But even if there is damage to the joint, the cause of it, that fire, that inflammatory, that immune fire, has to be put out. Either way. So either way, the strategy applies. Just these degenerative conditions and autoimmunity, you catch them earlier, you can do a lot more.
Yep, absolutely. So what are some of the ways that we actually diagnose rheumatoid arthritis?
Well, I guess you see it enough. You can just, smells like a bear, looks like a bear, acts like a bear. Well, then you call it, say it's got label it a bear. But a true diagnosis is, definitely get to your endocrinologist and your rheumatologist, and they have some really good tests. But some from a laboratory standpoint, HLA-B27, I don't order that very much anymore. I don't know if I've ever ordered it. I look at other markers in it, but that can be an indicator. Rheumatoid factor, yep. Rh factor is a common one. Also screening for Ana antibodies. That's a big one. And a lot of people are positive for Ana antibodies. It doesn't necessarily mean they have a specific autoimmune condition, but positive Ana antibodies, there is an association with Ra factor or Rh factor.
Right. And that's just like one of those escalation clauses like we've talked about in previous podcasts, right? So if the Ana antibody screening is positive, then you're going to want to move into some more specialized tests, right?
Yeah. Keep going to the next step and the next step. X-rays, I don't do any X-rays really. Do you see room?
Well, I mean, here's the thing. If it's progressed far enough, then yeah, you'll see it on X-rays. But I mean, if you're seeing it, especially in the fingers, right? If it's progressed far enough, you're seeing it on X-ray of the fingers. You're probably seeing it with your naked eye as well.
That's right.
So it is valuable. It does kind of rule in and out stuff. But if it's severe enough that you're seeing it in the hands and the fingers on X-ray, then the likelihood is you're already seeing it.
Yeah, and if someone is listening to this that hasn't been diagnosed yet, but they've got some achiness and maybe family with rheumatoid and all that, I think that the approach is, go to a primary that's going to explore it and decipher at least have a better idea. Is it something that isn't an inflammatory arthritis and more of a degenerative arthritis, like a osteoarthritis, or some of the other ones. So because if you know the type of arthritis, the strategies are going to be different.
Right. If it's an inflammatory arthritis or inflammatory arthropathy versus like mechanical, then it's going to change the way that you look at it.
Yeah.
Or degenerative arthritis.
That's right. Knowing what it is extremely helpful. So who are the risk factors? Who are the risk population with this?
Well, it's more common in female. I think 3 to 1 females to males.
Any form of autoimmunity is much higher.
more common in females, 30 to 60 years of age. And like you said, if you have a familial history of it, right, then you're going to be, a higher risk factor. And one thing that we looked up when we were looking up some of these statistics,
we're kind of surprised by it, right?
Yeah, is that it's actually higher in Native Americans.
Yeah. So. Yeah, for whatever reason. But this is an autoimmune disorder. So again, the autoimmune podcast would be really helpful, or YouTube video, whatever you're watching, would be really helpful to understand the mechanisms of autoimmunity, because this is just a target tissue. This is a disorder as a result of the immune system. So if you keep going up to the immune system, you can influence any tissue that's being attacked, including and a good example of this, of how it's so inflammatory. There's a lady I'm working with, or was working with, and she had all sorts of joint pain and arthritic pain and low back, a little bit of neck, a lot of hands, a lot of wrists, but a lot of low back stuff going on. And there was diagnosis of arthritis. It wasn't specified what kind. But, there was fatigue associated with this as a symptom. Well, the immune system, if it's fighting yourself, is going to make you tired, just like you have a cold. And, she got out of symptoms. She had a lot of digestive stuff going on and all these other things we were chipping away at. And we talk about this in the autoimmune podcast. So this is going to be helpful if you get into that. But we looked at all these immune irritants and started to work on them and correct these other disorders in the body. Well, her back pain went down she reported it 90%, and she's had it for decades. And
That's
her
awesome.
wrist pain went down, by 80%. And she was living on a cloud. She was able to do the things she wanted. Her life was back. Everything was great. And we're all little kids. I always say we always put our toes over the edge just to test the water. So
gotta push the limits, right?
Yeah. So she deviated a little bit from the routine that we put in place, specifically with the foods that
Yep.
And she went over the edge, and literally within 24 hours, her back started to ache. And then her hands started to ache, and there was a progressive incline in her symptoms. It was very frustrating for her naturally, but she knew what it was. But that's how fast, when we think of what do we put in our mouth is really going to affect our joints, it is night and day. It's night and day.
Yeah. And guess what? You can bet that her compliance went through the roof. Like, she will not do it again.
Yeah. When we put our hand on the stove and it gets hot, we pull it off right away. We remember that when that element is hot, we're never going to touch it again. So it's helpful, but don't underestimate the power of the immune system in joint pain.
Absolutely.
I wished I would have known that decades ago. So after all of that, some management strategies, I think we kind of touched on a little bit of that. Autoimmunity, listen to the podcast, watch the YouTube video of managing autoimmunity. But manipulation, I'll let you jump into that. Dr. Kolby, I know you do a lot of that still in the office.
Yeah, just joint mobilization, trying to remove any sort of like mechanical deformation of that stuff. Obviously, if there's increased points of friction, that's going to be more inflammation, increased stress on that joint. Yeah. So you can do some manipulation of the joints. Like you talked about, a good thing with the autoimmune podcast as well is that we talk about like immune irritants. That's going to be a huge one if you're suffering from RA. Anything that you are immunologically reactive to, you're going to want to try to pull that out of your diet or out of your environment. So if you're allergic to dogs, then you're going to have to remove the dog,
and you're going to have to know if you're allergic to dogs.
Right.
And a lot of times it's not, the dog comes by and you start sneezing, but it's a slow progression. It's very low immune irritant markers on a lab panel that would be called more immune irritation, immune reactivity, immune insensitivity, not necessarily a true full-blown medical allergy. Medical allergies, most of us know. Us know. So looking for those immune irritants, it's getting into our autoimmune podcast, but this is an autoimmune disorder. But you talked about manipulation. So kind of, define what that is. Chiropractic's one, yoga. I love yoga for inflammatory joint conditions.
Yep.
What else would people kind of go into?
Well, you could do like myofascial work, obviously, removing any of that stress and tension around the joints. You could do acupuncture, yoga. You could do, pool therapy, stuff like that. Any sort of thing that's going to remove any sort of tension or chronic stress on the joints is going to be beneficial and helpful to slow, at least. It's not going to stop the progression, but it can help slow it down and manage it. That's the whole reason we're giving you strategies for management, right?
Yeah.
It's not going to fix it, but it can help.
It's not going to cure it, but management is very powerful, man. Just the examples that I give, don't underestimate the power of managing these things.
Right. You
can have your life back. Don't see arthritis as, it's the end of, you're at the end of the road. This is all that you can do. It's a sentence. No. That's, that should never, ever be thought with arthritis.
Yep, absolutely.
Yeah.
So other than those, what are some other options? I know we actually, so we talked about the autoimmune component. We talked about removing immune irritants. We talk about the benefits of doing some like manipulation, whether that's like muscle or myofascial or joint,
or active motion, like
non-weight bearing exercise.
Non-weight bearing is really important. Really important with that, because weight bearing activities can flare this stuff up. So pool therapies and all of that can be absolutely great. There's immunosuppressants. The medical world works with immunosuppressants, dealing with and there's some pretty potent ones out there. There's orals, there's injections, there's infusions, and another story, there was a lady that had same thing, a lot of hip pain, and she was going for frequent infusions to manage her arthritic, her rheumatoid arthritis. And she had to go, and apparently they're very painful and very potent, but she would get like a couple days relief, and she would, where she felt her best, and then the steroids would wear off and it would be a slow progression. Her symptoms would keep climbing, and she had to go every month. But when she was willing to adopt and learn and figure this out and, be active in her care and do everything that was required, the last time I spoke to her was a year and a half, and she never needed one infusion, and she's still living on a cloud.
That's awesome.
So these things are possible. And I don't know, I just keep hitting it home that people don't have to suffer with this stuff, but corticosteroids, immunosuppressants, they shut the immune system off. They're a dream. They're a dream to get people out of those flares.
Yeah.
But it is not a long-term solution.
It's not a long-term solution. You've got to be proactive about it. You've got to be involved, and you got to have
another plan. You got to think about the long game, because the steroids, after a while, they don't work, and they're not going to be the whole picture.
Right.
Of it. So I don't know what else to say about rheumatoid arthritis other than there is, I tell people, and I never got slapped yet, but I know people wanted to. When I would tell them, we determine it's rheumatoid and they're suffering. I say, this isn't good, but at least we know what it is. And if any arthritis is, this might be the best one to have. And then I kind of step back because I know they're mad and they're suffering. And I say, this is why. This is an immune problem. It's not a joint problem. And hopefully we can catch this early enough before it's too big of a joint problem.
Right.
And I think anybody listening to this should really, really, really take those words seriously, because there's lots that can be done. You can ask us questions. We'll answer your questions. If you need a provider and you're in our areas, we can help. So what we do. And if you're not in our area, we can find somebody for you. But as long as you're willing to look outside the steroid model, there's a world of opportunity out there.
Absolutely. Mm-hmm. So if you got value out of this content, again, hit notifications, hit like and subscribe, and stay tuned, because we're going to continue to roll out content each week. If you'd like to get a hold of us, our contact information, we actually have an email associated with the podcast and the YouTube channel, which is info@brainstormingwiththedocs.com. You can get information at my website, which is www.northlakescheropractic.com. And then there's Dr. Glenn's, which is www.drgharrison.com. And yeah, reach out to us. We'd be more than happy to help in any way we can. And
all the links will be in the descriptions of this content. So
absolutely. So
all right. Well, that was good, Dr. Kolby. I look forward to the next one.
All right, my man. Sounds good. I'll talk to you soon.
Okay. Well, bye.